We're good? You all ready? You good? Ready? Good. All right, ready? All right, here we go.
What's good, y'all? Welcome back to Conversation Piece, your place to discover the untold stories of Indianapolis through the perspectives of all of its wonderful people. My name is Patrick Armstrong. I am your host, and this is The Open Door, our monthly series where we literally open the studio door and sit down with members of the community to talk about whatever is on their hearts. If you are interested in participating or you want to learn more, go to conversationpiecepod.com and click on the open door at the top of the page. And last but not least, shout out to Life in Indy and the team over there for sponsoring this series. Now, without further ado, let's get into it. My guest today is Taylor Hahn. Taylor, thank you for joining me.
Thank you so much for having me.
Absolutely. For folks out there that are tuning into us right now who may not know who you are, do you mind sharing just a little bit more about yourself?
Of course, yeah. So I am a board-certified OBGYN. I do a couple of different things actually, but my primary focus right now is overall gynecologic women's health. I also work as an OBGYN hospitalist, but my passion really is kind of the non-obstetric side of women's health. Sort of the side that I think goes a little ignored and underappreciated.
Sure. You said non-obstetric?
Non-obstetric. So no babies portion.
No babies portion. I was going to ask what that meant because I was not 100% sure.
Yeah.
Okay. Why that particular focus, if you don't mind me asking?
I think if you really look at the time period of when my patients are having babies, it's only a few years, right?
Okay, yeah.
And then who takes care of them and who and what kind of care do they receive for the remainder of their lifetime? And I think that has been a portion of my specialty in general that has really, the focus has not been on that. I think the focus is coming to that, especially in mainstream media too. There's, I think, been a lot of talk about just overall women's health, especially related to menopause.
Yeah.
And so I love that we're having those conversations.
For sure. Well, when you fill out the form, I think that's what you kind of maybe wanted to talk about, but I wanted to ask you, like, what specifically about women's health should we be talking about right now? And what are you most interested in talking about today?
Yes. So what I am kind of wanting to bring to the forefront or bring to light in terms of women's health is, the practice that I'm starting is actually a direct care gynecologic model. And a lot of people might not be familiar with that model or may have heard of the direct care model through direct primary care or DPC. It is a model that functions outside of your insurance space.
Interesting.
Yeah. So what I love about that model is that I don't have insurance companies dictating the length of my appointments, the type of care I can provide, or the type of care I can offer to patients as well. And it really, I think, is going to be a game changer, especially in the next 5 to 10 years of how people interact with the healthcare system too.
Yeah. Well, I think a big conversation or a big talking point around it is accessibility.
Yes.
And part of the issue with insurance companies right now is they make it inaccessible.
Yes.
Like healthcare is not accessible for folks, particularly for women.
Absolutely.
Was there like a specific point in time or a moment that you realized like, I want to make this push to offer more direct OB care? Because I feel like right now maybe this is not the right word, but to me feels particularly dangerous almost to step into that because people want you to have to pay and be behind all of these barriers to do it. And so to take a step to be like, I'm going to provide this necessary healthcare to people who need it, whoever be damned, like, I think that's awesome and courageous. Like, is there a specific thing that's like, I need to do it? Or is it just like society is going in a direction that we need people to step into the gap?
For me, it was a little bit of a mix of both.
Okay.
I have practiced as a general OBGYN, so seeing both obstetric patients and general women's health patients in the office. I can remember many a time where I would be in the middle of a visit in the office and they would call me for a delivery on labor and delivery. And I would have to interrupt the patient and say, can you please reschedule? I have to go do this delivery.
Dang. In like the middle of a conversation.
In the middle of a
appointment.
conversation. Yeah. And what kills me the most about those moments is that I don't want my patients to think that is how I function at baseline.
Sure.
It's more so a reflection of the kind of systemic issues and where the expectation falls for how your doctor is just supposed to be everywhere and everything to everyone.
Sure, 100%. I feel like another thing too that probably is throwing wrenches in like your move in this direction and just healthcare in general is like guidance coming from federal levels now.
Yes.
How are you navigating like stuff like that? Like, because I feel like it's not only affecting you at your day-to-day full-time, like in hospital job, but it's also like, or like in clinic job, but it's also affecting what you're trying to do individually.
Yes.
And like to bring care to other people who don't currently have access.
I might be a little bit of a bit of a moderate when it comes to how I function within healthcare system and within the direct care model that I'm creating, because I do think that there's definitely the approach to be evidence based, and you really want to strive for that. But there is always going to be a lot in medicine that we don't know, and a lot in science we don't know, right? And so I think that it's very important also to actually evolve your practice and not just be stagnant in I only do this one way and take it or leave it. Yeah. Because I think patients too nowadays are looking for more of a conversation. They're looking for options and choice. Yeah. And that is really what I'm hoping to provide with my new practice too.
Okay. I like it because I feel like we have such access to information, even though we want to have access to care.
Dangerous
we have
access to information.
To then want to talk about.
Yes.
And do you find that it is usually a conversation, or is it more, do conversations start combatively because people have all of these voices and articles and things that they're reading prior to coming in, and then you have to work to dispel some of that before you can really get into an actual conversation about healthcare?
Sometimes that happens, but I will say, and maybe I've just been very lucky in the interactions that I've had with my patients, but really, patients are really striving to find good, solid evidence to really support their healthcare decisions. Yes, most patients have done a Google search or they've seen something on social media. And I actually encourage that because that's the society that we live in. That's where you're going to get your information. But what is the conversation that we can have to make sure that you're making good, sound choices for your own care?
I love it. So as you move towards developing this direct care model, like what does that process look like, and when does ideation turn into execution, turn into like, okay, this is a full business now?
Yes. Well, we are basically very, very close to seeing our first patients.
Nice.
I don't know if you know anything about when doctors go through med school, but they learn very, very little to nothing about running a business or starting a business.
I believe it. I'm assuming you're learning about like doctor stuff.
Yes. So, I mean, unless you like go and get your MBA as well,
Sure.
Most physicians are not really learning the business side or starting your own practice side. So a lot of that has been trial and error, a lot of research on my own. Yeah. And then I am part of a really wonderful support group of independent women physicians in the Indianapolis area.
Nice.
And they're so supportive. They guide you. They offer words of advice or wisdom in, how they've done their process. It's been a really big help.
Okay. Are there a number of direct care options currently? Like, I don't even know that I've heard of like direct primary care, I guess, but my mind always goes to like urgent care, which is not primary care.
Right.
I think,
right.
Which I've learned as now that I'm a 30-year-old adult and parent. Like, you can't just go to urgent care for everything.
Yes.
What was I just asking?
There are a lot of direct care.
Direct.
So I would say we are, and that's kind of what I'm excited about, is that we are sort of the first actual direct care gynecology model.
Okay.
There are obviously a lot of direct primary care practices, and big fan of a lot of those practitioners and practices. There are some other specialties that are doing this model as well. But we're kind of new to the scene. So, so I know that there's going to be some, some pushback or some, question of, is this model really going to work? But I'm really confident in it and really confident in my team as well.
For sure. What does it look like to how are you pulling a team together to start this? Because I feel like obviously it's not, nobody can do anything alone, but like, especially taking healthcare direct to patients. Like, I feel like you can't just do that. Like, you're not just like, put on a mask and then your stethoscope or whatever, you're just running out like a vigilante doctor. Like, you have to have a group of people to help you do the things that you're doing. How does that team come together? And how do you find people to trust to like help you start something that I feel like can be really intimate too for you as the leader of it? Yes.
So I have one nurse practitioner and I have one RN or nurse who serves as my practice manager. We actually, and that's a story for another time, but we actually were in a practice together previously, and that practice closed. So in doing this, I had already had this vision kind of set on a path before they were kind of in the picture. And then it just kind of came together. I like to believe in serendipity. So it sort of came together serendipitously. So
I love it. I'm here for it. I tell people I'm not like a believer in fate, but I'm a believer in timing.
Yeah.
And I
timing
feel like
is everything.
Timing just like, it just happens and you never really realize it until like you're 4 months removed and it's like, oh, that was supposed to happen then.
Yes.
You talked about like doctor, like when you're going through med school, you're not going through business school, like you're not getting your MBA. So like if you want to strike out on your own and do your own thing, you've got to do a lot of that learning on your own. You said you've done a lot of like the Googling aspect of small business learning and entrepreneurship. You have a group of women healthcare practitioners who've done similar things that you can tap into as well. What other resources have you found from a business perspective that have like really helped you get this moving forward?
All of the sites through the state of Indiana have actually been really helpful. Not to like put a plug in for them, but but they have been really helpful in just kind of walking you through things that you may not have even thought about. That not just the things that are related to the medical side, but also like strictly just baseline. What do you need to be legal in the state of Indiana? What do you need to think about 3 monthst from now that needs to be in place? The timelines were really what got me the most, where, and I'm very much I'm a list maker and love my Excel spreadsheets. So that was kind of trying to put my brain on paper, was going through those websites was actually really helpful.
And you said now you've got the spreadsheets out, you're seeing from spreadsheets to now like in action almost, like getting ready to take action, getting ready to welcome in first patients. When is that time? Like, when does that door open?
We have patients scheduled on Monday.
Okay, so very quickly. So this will come out post Monday.
Okay, perfect.
So I can't ask you now to think about and reflect on how Monday went, but I'm going to ask you now in this moment how you're feeling as you get ready to really open the door for the first time and step into this. What are you feeling? What are your thoughts? Like, I know I got you in front of a mic and cameras right now on the spot, but like, what is that? What's that feeling? What's that energy like?
Joyful stress.
Okay.
It is really how I describe it, because it has really been, it's obviously been stressful to go out on your own and take a leap of faith, but I'm really excited. And also just excited to get back in patient care. I am a talker.
I love it.
I love to really get to know my own patients. And again, I think everyone in this area is excited for just the type of women's healthcare that we're going to provide. It's not just focused on whether you're going to get pregnant or not. It is, it's really care that is personalized. I take more time. So my appointments are not, 5-10 10 minutes.
Sure.
They're like an hour.
Yeah.
So I can actually understand what is driving your healthcare decisions and be able to guide you through that.
Well, I love it. And I think I talked about it a little bit before, but I feel like it takes a lot of courage and bravery and fortitude to do something like this, not just in this time, but particularly in this state.
Yes.
And I think the fact that you're doing it is going to have a major impact on a lot of people and in ways that you and us aren't aware of right now. Like,
Wonderful.
it's not, the doors aren't even open yet. It's not Monday yet.
Yeah, thank you.
But like that impact in a place like Indiana, a place like Indianapolis, I think even just the concept of it is already like, why are we not doing this? And how can we not throw our full support behind it as a community? So
Thank you.
I share all of that because I have two more questions as we kind of come to a close. And I definitely want to have you back for a longer conversation about this and other things that we've found that we have resonance and common ground on. But as someone starting a first time, first of its kind program, particularly for healthcare, particularly for women here in Indianapolis, what does the city itself, what does Indianapolis mean to you?
Oh gosh, that's a whole other episode too. Indy is home for me. I came here for residency and then left for a few years to pay back time to the military. And then my husband and I actually met here while I was in residency. And so this has always sort of been wherever we've been, it's sort of been home.
Yeah.
And so when we were deciding where to go after my military time, I was like, I think we need to go back. So, and we did. And so I really am big on community and trying to build within the community that you're in as well. And I'm really excited to just really see this grow and grow for the women of Indianapolis, greater Indianapolis area, and Indiana as a state.
100%. Well, I'm glad that you ended up here. Again, I talked about timing. Like you could have went anywhere. You probably could have started this anywhere else, but you ended up here and you're starting this here. And I think personally, as a husband and now as a father, and thinking about like any future kids that we have and how my wife is going to have to navigate healthcare in this particular state because we're not planning on leaving. Like it makes me feel a lot better now having met you and knowing that you're doing something that may be beneficial for her and is going to be very beneficial for a lot of other people in the city.
Thank you.
Absolutely. As we wrap it up here, for people that are watching and are like, okay, Monday, put it on my calendar. I got to go get in line at the door because I need to get my name on the list. How do they find out about the clinic, about the stuff that you're doing? How do they follow you? How do they support you? How do they do all of those things going forward?
So my practice name is VIA, VIA Women's Health Collective.
Okay, I see the branding here now.
Yes. So they can visit the website. It's viawomenshealth.com.
Okay.
We're also on Instagram, Facebook, LinkedIn. And then I really like to do a lot of patient education as well. And I do that on my own personal social media. And so that's just Taylor Hahn, HAHN.MD. So that's on Instagram, Facebook, LinkedIn, all the things.
Amazing. Well, Taylor, thank you so much for coming and sharing a lot in a little bit of time, a lot for us to unpack and a lot for people to take home, but a lot for us to come back to the table and have further conversations. So
absolutely.
I appreciate you making the time. I appreciate you coming down from Westfield and sharing with us, and excited to share this conversation with everybody else.
Thank you so much for having me.
Absolutely. Everybody else, make sure you check out Taylor, check out VIA in the show notes, everything linked in the show notes, and go to conversationpiece.com for everything Conversation Piece. Shout out to Life in Indy for sponsoring this series. And until next time, I've been Patrick Armstrong. This has been The Open Door on Conversation Piece. We'll see y'all soon.